Are you thinking that you might be ready for a facelift? When people come to see me for a facelift consultation, I look for certain characteristics that would be appropriate for a facelift procedure. Depending on age, gender, and anatomy, I customize facial rejuvenation options for my patients ranging from non-surgical to surgical, in addition to minimally invasive options that I've developed with newer technology. There are a few important factors I look for when examining patients who are interested in a facelift. First, let's define what is a facelift. A facelift, or what's often referred to as a lower facelift, is performed to address drooping cheeks, jowls, and sagging neck skin. Any search for facelift procedures generates a number of types of facelifts, such as deep plane, SMAS, and a range of branded procedures with clever names. In practical terms, there are three main types of facelifts which are chosen depending on the extent of facial and neck aging. At a minimum, facelift surgery addresses laxity or sagging of the skin, and very importantly, the underlying facial muscle layers. Let's start with a short scar or mini facelift. This term short scar describes a relatively smaller length of incision adjacent to the ear to lift the skin and to access the facial soft tissue and muscles for repositioning and tightening. Essentially, a short scar is shorter than a longer incision that would be needed for a more extensive facelift. The short scar facelift or mini lift is typically appropriate for the younger group of facelift candidates, usually someone in their 50s. Oftentimes, people at this stage will opt for procedures like thread lifts, hoping to avoid surgery. In actuality, thread lifts results don't come close to proper surgery. Threads make for entertaining posts on social media and nothing more. The assumption is that the threads will stimulate collagen production and lift your skin. This may sound logical, but for people in their 40s and 50s, facial volume loss, particularly the bone structure and soft tissue, has a more significant impact than some loss of collagen in the skin. The perception that your skin is sagging is from loss of support from the bone structure. For many of my patients in this age range, I enhance their facial structure with deep placement of hyaluronic acid fillers with results that can actually look like a surgical facelift. You can learn more about this technique in the Y-Lift structural volumizing section. After the short scar or mini procedure, the next level procedure in my practice, I simply refer to as a facelift. The facelifts I perform include deep plane and the full range of SMAS type facelifts. These procedures all involve different ways to elevate and tighten the deeper facial muscle foundation called the SMAS, which stands for Superficial Musculoaponeurotic System. I routinely perform this type of procedure for people who are in their late 50s and older. When the skin and muscles under the chin have descended more significantly, I perform a face and neck lift procedure. The difference is that with the face and neck lift procedure, the incision is more extended from behind the ear and into and down in the area where your hair is. This allows me to address the sagging skin in the lower neck area more effectively. The typical patient for this procedure is in their 60s and older. I routinely perform all facelift procedures using local anesthesia with light IV sedation. My patients are more comfortable and recover faster as they avoid the common side effects associated with general anesthesia. Conventionally performed facelift surgery often requires overnight stay in a medical facility with continuous nursing care. In contrast, my patients have the same surgical procedure and walk out of my office and recover at home the same day.